GSK3359609 is a monoclonal antibody treatment developed by GlaxoSmithKline and is currently in phase 2 clinical trials as a novel treatment for non-small cell lung cancer. GSK3359609 is classified as an inducible T-cell co-stimulatory agonist antibody, otherwise known as an ICOS agonist, and is designed to enhance our immune system cell function in fighting tumors. Let's first take a look at our immune system. Our immune system is a complex network of cells that work together to protect us against potential infections and diseases. This includes cancer. The main players in the immune response against tumors and cancers are what are known as T cells. The two types of T cells that we're most interested in are helper T cells and natural killer T cells. Let's take a closer look at the battle between T cells and cancer. First, helper T cells identify the cancer as a foreign invader and a threat to our body. In response, these cells send help signals to other immune cells to help coordinate the attack against these invaders and ensure that they destroy the harmful cells as quickly and efficiently as possible. Among the cells that respond to the help signals are the natural killer T cells. Natural killer cells directly target and destroy the cancer cells. Natural killer cells can also directly run into and destroy cancer cells, independently of receiving the help signals. So, if we have these T cells fighting the cancer in our immune system, how is the cancer able to survive and thrive? Long story short, the cancer overpowers our immune system. Our immune cells are overwhelmed. They can't effectively fight and defeat the cancer. To make matters worse, cancer can also find ways to avoid being attacked by our immune system. Our immune system has a method for telling whether cells in our body are normal or foreign, using a system called checkpoints. Immune checkpoints are molecules on certain molecules that need to be activated to initiate the immune response. Cancer cells can find ways to use these checkpoints, such as deactivating checkpoints, to avoid being attacked by our immune system. Thus, scientists are curious if one method for treating cancer is if we can target these checkpoints to empower our immune system and T cells to better identify and fight the cancer. One checkpoint that is especially interesting to scientists is called inducible T-cell co-stimulator, abbreviated as ICOS. ICOS is found on our activated T cells. Additionally, the tumor itself is thought to also contain these ICOS checkpoints on their mutated T cells. As the name of ICOS suggests, this checkpoint stimulates T cell responses when activated. Specifically, it is hypothesized that increased activity of ICOS stimulates the proliferation of T cells and enhances the survival of natural killer cells in their fight against cancer, increasing the overall immune response against tumor cells. It is theorized that this ICOS checkpoint is deactivated by the cancer, or, at the very least, the ICOS is not active enough to effectively fight the cancer. This is where GSK3359609 comes in. GSK3359609 is an ICOS agonist. The term agonist essentially means that the drug activates whatever it binds to, which, in this case, is ICOS. How it hypothetically works is that the treatment finds and binds to the ICOS checkpoint on our T cells or on the tumor itself. After binding to the ICOS, the treatment enhances the activity of ICOS and initiates the signaling pathways for both a greater number and more effective T cells to help fight the cancer. The agonist binding to the ICOS expressed on our own cells and tumor cells stimulates the rapid creation of T cells, enhances the survival of our natural killer cells, and increases the T cell's overall ability to fight and kill tumor cells. With more activated ICOS in our body, initiating and enhancing our T cell function, we thus give our immune system a better fighting chance against the cancer.